All right.
I didn't catch
Question
the
for
question.
Dr. Huggins. My question is it loud? Yeah. Very interesting to hear you begin to talk about the metals and microbes issue, how the exposure to vanishingly small quantities of most metals seem to potentiate bacteria to produce toxins of various types. My question is, how is it possible for a person to exist in this world without having 10 to the minus 9th or 10 to the minus 12th molar exposures to everything in the periodic table and plutonium besides?
Well, if you look at the telomeres on our original DNA, our original warranty was for 1,000 years, and if you look at Methuselah, Methuselah almost made it. You know, he was 960, I think.
Jared was 960. Methuselah actually made 1,000. His grandson Jared was 960.
His grandson made it to 1,000?
960.
960.
Lasted longer.
Oh, okay. But the point being that we don't live much past 100 anymore. So, yes, our DNA has been destroyed down the line, and this is not going to happen. But statistically, I did notice that if we look at all of the mutations, now that's one thing I did not cover, was that in nature, mutations occur 1 in 10 million cell divisions. All right, keep that in mind, 1 in 10 million. I have one slide that I can show that has 4 mutations in 20 of those bacteria that we were talking about, which is something like 150 million% increase. So statistically, you could show it would be possible to wipe out the population of the world in 3 generations. Now, this is not going to happen, but from Methuselah down to here, it has been happening, and now with the things that we have available in dental materials today, the chances of increased numbers of diseases, well, we're seeing the word atypical. Atypical diabetes, atypical MS, atypical ALS. These did not occur 20 years ago. They are now. So I think in answer, in response to your question, that how is it we're still alive, we have a whole lot better immune systems than I thought we did. And the question is, how much longer are we going to continue being alive if we continue the spiral down at 4 in 20 mutations instead of 1 in 10 million? So there.
I have a question for Dr. Shealy. One of the rages that's happening in anti-aging medicine today is the bioidentical hormone replacement therapy. And I have some ongoing concerns. I'm not a dentist, I'm an MD, and I have some concerns about, basically exogenous administration of hormones and suppression of the hypothalamic pituitary gonadal axis, and a very delicate feedback system in the body. And like yourself, I prefer to think of ways to get the body to make more on its own. It's much better than trying to regulate it from the outside. But one of the other concerns is that there is a subset of the population for whom exogenous administration of testosterone, for instance, can actually set into motion a chronic degenerative neurological diseases. And I wonder if you might comment on that.
Well, I agree with you that anytime you stimulate by exogenous a normal return, you're going to put something out of balance. And I personally am 80 years old, and I don't take testosterone, but I do take some of the things that can help stimulate the body make its own. There are a number of herbs that can help. The one that I particularly like is a combination put out by Now Products called TestoJack. It jacks up your testosterone. I mean, it's just a combination of maca and a few others that do that. My own experience is if you could stimulate the body to make its own, I've never seen a problem. Now, with women at menopause, of course, the only thing, and I'm in the very early stages of looking at this, but I now have 10 women who are using the Air Bliss oil on the Ring of Air who have remarkably controlled all of their menopausal symptoms, which theoretically are from a reduction in estrogen, possibly through a little testosterone, I'm not sure. But at any rate, I'm going to look into that more because it works like within hours sometimes to control menopausal symptoms and libido. And so I would rather do that. Personally, in a man who's going to use it, I would prefer the transdermal to those pellets. I think that's an abomination to cut a little hole in the body and inject pellets in it that last 3 months. But there's not enough studies on that yet, I think, to know unequivocally. And there's good evidence that low testosterone does increase the risk of prostate cancer. And there's no evidence that bioidentical testosterone, at least transdermally, has done that at this point that I know of.
Next question. John, you got another one, I'm sure.
Dr. Shealy, the essential oils are a problem for a good number of chemically sensitive patients. Do you have any recommendations about how to get around that?
Well, I'm working on that right now also. What we've found so far is less than 1% of people who object to the ones we've used. And we've got a couple of thousand people using them. One patient who's a psychologist actually had an ocular migraine from trying it the first time. I've got 24 people who are controlling their migraines with it. We're working at the moment on reducing the strength of the mixtures. So we've got it down to about a 12.5% instead of whole oils. And so far, and it's too early because it's only the last 3 weeks that we've been working on the reduced percentage. We think that the 12.5% will do just as good a job. And so far, at least half a dozen of the highly nose-sensitive people are doing okay with it.
The chemically sensitive issue in itself is an entrainment issue, and have you thought of any ways of re-entraining them so they don't have to be so reactive?
We've only had a couple of people who get a slight redness from the whole mixture, again, out of at least a couple of thousand. But again, I'm reducing the percentage to see if we can take care of that problem with them as well. I think, when I took my first official acupuncture training with Felix Mann in 1974, he taught us about highly sensitive people who, can only take a half or less of an aspirin, and he would only put one needle into him no matter what he was doing with acupuncture. These people are part of this syndrome that is the degeneration, if you will, of the human race. It's what I call electromagnetic dysthymia. And we have a whole bunch of people now who are highly, highly electromagnetically dysthymic. So they're very sensitive to fluorescent lights, to other forms of electromagnetic energy. They're depressed. They're deficient in a whole bunch of amino acids, especially taurine. They are deficient in intracellular magnesium. They have abnormalities of norepinephrine, serotonin, beta endorphin. The whole chemical smear is out of balance in those people. Now, we can get them back in balance slowly over a period of about 3 months with some of the tools that I've been talking about. They all need a cranial stimulator, in my opinion, when they have severe electromagnetic dysthymia. They'll only take 1 milliamp transcranially, but it helps begin reset the neurochemical thermostat. And they're going to need it for 2 to 3 months, in contrast to a regular depressed person who may only need it for 2 weeks or 4 weeks at the most. They need magnesium. They are all highly deficient in intracellular magnesium. Incidentally, blood magnesium is the most stupid waste of money and blood in the world. You do not develop a deficiency in magnesium in the blood until you're starved to death or acutely alcoholic. you will steal magnesium from your bones to keep the blood level natural. There's a test called Intracellular Diagnostics in Medford, Oregon. It's scraping, like a pap smear of the frenulum of the tongue. You send it off to Medford, Oregon, and they'll tell you the magnesium, the sodium, the calcium, the potassium, the chloride, etc., and the relative relationships of them. And I strongly recommend that on these kinds of people because they're way out of balance.
Dr. Kennedy, is there any test besides a bone biopsy to assess fluoride status? Any biomarkers, anything like that?
Well, your daily urine will tell you your daily exposure. You can take a fluoride history. Some people think they can read it off an X-ray. I don't believe that. I haven't seen any convincing evidence that that's correct. But I haven't done a lot of research on that either. But your body burden is in your bones, and so bone biopsy if you have an opportunity. Otherwise, you can assess the daily dose of fluoride by analyzing the urine and then multiplying times 2 if you've got good kidneys. Kidney removes the fluoride, so if you get 2 coming out your in a daily 24-hour urine, if you get 2 milligrams coming out, you're taking 4 milligrams in. So kind of the math.
Mine's also for Dr. Kennedy. You are showing some pictures yesterday of vegetables and fruits and the amount of fluoride that was on them, I guess residual pesticide use. Is that just, and also when it's canned and stuff, is that just from not washing your fruits and vegetables as well as they should be, or does it become impregnated into the vegetables and the fruits where you really can't get rid of things that you eat with skin with fluoride?
They consider the skin of the potato inedible. So my mother always told me to eat the skin. Maybe that explains it. Anyway, so those were permissible levels that I was showing you. Where I threw up all the vegetables and all that stuff, that was permissible levels that are permitted in the food. And then when I showed you another graph that had multiple different foods like Lucerne milk and Wheaties and Fruit Loops, those were levels that we measured. So I probably wasn't clear enough on that, is that the permissible levels are probably considerably higher than what they're getting now. But, I mean, Wheaties at 10 parts per million. Who wants to eat that? Brush your teeth with Wheaties. So anyway, we're not being protected at all. Our protective agencies are totally neglecting us. So, but you probably cannot wash much of fluoride off if you're buying non-organic vegetables. Do not eat the outsides of them because if they're not using fluoride, they're using Roundup or something else. So anyway.
This is a question for Dr. Huggins. What's the mechanism by which the slower the vitamin C IV drip, the more beneficial to the body in terms of detoxification?
A very simple answer to that, I don't know. But it is obvious clinically. And we noticed this back in 1968. And I keep seeing it. I have no idea what the mechanism is, but the faster you give it, the less effect it has. So that's reason enough for why we do it the way we do it.
And this is a follow-up question for anybody who wants to answer. I'm an MD, and I've had dentists report to me that they don't want their patients to have a vitamin C drip soon before they get dental anesthesia because it might abort the anesthetizing effects of the anesthetic. Any comments on that?
Yes. This is true with the oral doses of vitamin C. That if you give as much as 500 milligrams in the morning and have a dental appointment in the afternoon, the anesthetic obviously wears off in 5 to 10 minutes, where you'd expect it to go 4 hours. And I have talked directly with anesthesiologists who have no explanation why we can give 50 grams to a person during a dental procedure, IV, and it has no effect on the anesthetic, but taking it orally, it does have. And the world of anesthesia has no answer for that except that the opposite should be true. But it isn't. It's quite evident when a person starts flying out of the dental chair that they're feeling pain.
This question is for Dr. Huggins. What about synthetic bone grafts like the beta phase tricalcium phosphates for bone grafting, as well as the use of blood products, the platelet-rich fibrins?
Platelet-rich enrichment seems to be okay. I have no problem with that. But going back to what Dr. Schwarzenegger said, anything implanted in bone will create an autoimmune response. After doing this for 20, 30 years, I can see that, yes, that is true.
Hal, may I opt on that for just a minute? Because in
Well, I
neurosurgery...
haven't decided yet.
Okay.
I'll let you know.
We've only known one another 35 years. In neurosurgery, we have been using autogenous bone grafts for 50 years now, and I've done a few hundred of them myself, and my neck is fused from here to here with it. If you use human bone, is that a problem?
If it is cadaver bone or from somebody else, there's no MHC there, and yes, there will be a problem. And we do see a problem with autogenous. And supposedly you shouldn't, but DNA evidence shows us what's there with autogenous bone, and it's not healthy.
It's interesting because I have a fusion for me. I don't have any autoimmune problem, and I'm very healthy. And I've done hundreds of them myself, and I haven't seen a known problem. The problem that I saw most way back when Mayo Clinic was recommending 20 milligrams a day of sodium fluoride to, yes, back in the 60s, they were recommending 20 milligrams a day of sodium fluoride to make bones heal faster. And I found that it caused bursitis, big, major bursitis in 25% of people. Mm-hmm. And I wrote to them, and, oh, yeah, that happens, but they never reported it.
Oh, okay. Well, the problem, of course, with the bone grafts that we have seen is there are so many different bacteria that can show up in so many different places. Like, were you in on my presentation? You're probably out chasing women.
I'm sorry? No, as a matter of fact, my first fusion, I was operating on a man who was paralyzed acutely, a farmer, and I asked his permission to take a piece of bone from me the next week while I was fusing his bone, and I froze it and took it to Cleveland to have my fusion done. But after that, when I had to have a second one after some jerked my neck, I had cadaver bone put in. That was 1995. Mm-hmm. And it's...
Well, if you have, what I showed was in that one bone graft, 54 different pathogens in that one sample. Well, the potential out of 54 pathogens was like 40 different diseases, which you probably, maybe it occurs 3 months, 6 months down the line, and far enough away from the site that you'd never notice it. In fact, we've just had some cases of Magellan's disease, and thousands of dollars of testing were done on this poor woman. I mean, we have a stack this high of all the tests that were done because she had all this stuff growing out of her neck, these fibers. Well, the fellows in my laboratory figured out how you could do that, how you could form these. They were very similar to nylon 660 or whatever it is. Within one carbon could be manufactured by some of the things that are present in the oral cavity, but what they never did look at is she had a bone graft placed on an upper bicuspid, and this appeared in the neck like 3 inches away. And thousands of dollars worth of tests and years in testing, nobody ever connected the two. But, if it happened in the liver or in the big toe or someplace, then you really wouldn't look for it.
My question's for Dr. Nunnally. Do you come across G6PD deficiencies very much? We came across our first one within the last 2 months, and I was just curious, even as we've called around, obviously it created some higher concern in us about, how to identify people who have that problem. What are your methods for trying to determine that, and do you have a lab that you use to try to identify?
So the question is, for those of you who don't know, a G6PD deficiency is a glucose 6-phosphodehydrogenase deficiency, which is an enzyme that helps keep our red blood cells intact. And if you have a patient of Mediterranean descent, or if you have a patient with a history of acute anemias, there is the potential to have a cascade collapse of the red blood cells if they have a high dose of vitamin C. And the answer in my own case is I've seen 2 cases, interestingly enough, within 6 weeks of each other, and they're the first 2 cases I've dealt with in 30 years. And the first case, the patient barely survived. This patient was a Caucasian, had absolutely no history whatsoever of anemia. It did have had an ancestor from the Mediterranean, and apparently, obviously, was genetically predisposed to it. Spent a week in the ICU and survived and is doing well, but it was a scary time. The second patient was one who presented to my office and gave the history. We had a G6PD run on the patient, and she was positive. So I don't typically test for G6PD. You can have it done by LabCorp for $99. It takes 2 weeks to get it back, typically. And I know, for example, Blanche always tests for it. I think it's a wise thing to do. I just typically haven't done it, but my history taking has gotten, I'm just much more thorough in my history taking. So
I know for me, just talking with the patient, like one of the outward things that he could notice is that his urine was like black.
yes,
It was so dark. So, I'm going to be...
high dose C. And probably it's not a concern if you stay, there's just very few reports in the literature of this, and there are only a couple of documented cases where the patients did not survive. Most do recover, but in the doses that we're giving of 50 grams, which is a therapeutic dose for a 150-pound person, you have that potential to have this crisis. And so when a patient calls you at midnight and says their urine looks like coffee, they need to be in the ICU.
Do you give, with your 50 grams of vitamin C, do you give vitamin B6?
We do not. We typically give...
Okay. I would strongly advise always to use something called a Myers cocktail. I have done thousands of them over the years. A Myers cocktail includes 100 milligrams of B6, 100 milligrams of B complex, 1,000 micrograms of B12, some calcium, etc. And that prevents this from happening. I've given as much as 125 grams of vitamin C IV. I've never had a problem, and I literally have done thousands, but I always give a significant dose of B6 with it. And in anybody who takes 2 grams or more orally, I strongly recommend they take at least 25 milligrams of B6, if not B complex, when they do it, because you can get kidney stones, of course, as well occasionally from taking large doses of C without adequate B6.
You're saying
Well, I do 100 intravenously. I do 100 milligrams of pyridoxine and 100 milligrams of B complex in the IV, and I've never had a problem. And I've been doing this since 1988. I've done as many as 5 a week for a month in some people with cancer, and I've never had a problem but I've always used the Myers cocktail.
The one reason we've typically stayed away from B complex, B12 in particular, is because of its potential to methylate mercury. And so we have chosen just to stay with vitamin C. But just like Dr. Shealy just has mentioned, there are physicians around the world who have given Myers cocktails for forever without an issue. We happen to see a group of patients, most of whom have mercury toxicity issues, and we've also seen those patients who have been on high B12 regimens and they've gotten more ill. And we suspect that's from a methylation issue, because the mercury's been methylated.
I have a question. I have a microphone, I have power. My question is about water filtration to remove fluoride, if you have any preference or precautions.
They're approximately, well, the best way to get good water is to find a good clean spring or a mountain water that is not contaminated. Okay, so barring that, the filters that you buy in the store and so forth generally don't remove it. There is a filtration system with activated alumina, so you get a little aluminum to replace your fluoride, which in nanomolar amounts will become an endocrine disruptor. You can run it through bone char, and Dr. Huggins will tell you about the DNA that you're washing out of the bone char, but that's actually used in quite a few countries, especially Thailand and China, to remove the fluoride. And a chemist will tell you that you can remove 100% of the fluoride with deionization. You can buy a deionizing resin, or you can distill it. So if you want pure water, you basically have to make it, or go to the Himalayas. And what about your whole house? That's a real problem. We're doing some work with that right now. We'll put together a set of columns that self-flush every 3 days and waste of water that goes into a garden. But it was able to do using bone char and aluminum. This is not for drinking, but bone char and aluminum and several other reagents to filter the water. We're able to get San Diego water, which is a really hard water, down to 0 parts per million fluoride for 15,000 gallons. And then the equipment began to fail. It went up to 0.2 parts per million. At 30,000 gallons is up to 0.4, and so we're going to discontinue the experiment and reconstitute them and see if there's a better way. But there is no good way to get fluoride out. All waters have some fluoride in them if they're coming from a well. The highest fluoride waters in the United States are in Colorado, Texas, and Indiana. It's decomposed granite. The universally low fluoride waters are runoff waters, rain, rivers, streams, and that sort of stuff. If you catch, but San Diego's at the end of the pipe, so when they flush in Utah, we get a little more fluoride down in San Diego.
This is a question for Dr. Shealy. The stimulator that you used for a while that had a frequency similar to DNA, would it be reparative? Was it reparative of the DNA that the FDA hassled you about?
Well, I actually, our work with DNA has been primarily with telomeres. And we have been working with regenerating telomeres now for the last 5.5 years. And although the stimulator might do it if you used it on the rings of fire, earth, and crystal, I don't know anybody I've been able to convince to do that. So we instead made a mat that goes on top of the bed. It's 2 inches thick. And in the center of that is copper wire on which is 1 pound of crushed sapphire crystal. And that is has a wire that comes out that's attached to a Tesla coil. And that, when turned on, generates human DNA frequency at the exact same strength that we need, 75 decibels, or a billionth of a watt per centimeter square. And it'll generate a field about 2 or 3 feet deep. And if people will lie in that for 30 minutes out of the 24 hours, 70% of them get a significant growth average of 4.5% of the telomere length per year compared to the usual shrinkage of 1%.
Another question. Well, could I ask? I'll ask one more question. This will be for Dr. Kennedy. I heard on somebody. I wish I could remember his name, but he's on the Coast to Coast AM show, talking about weather modification, and that now there's reports in Europe that they're actually dumping a lot of fluoride into the atmosphere. Do you know anything about this?
No, I hadn't heard of that. I'm not familiar with that.
Next question, Bob. Sorry, one here and then two here.
David, there are claims that reverse osmosis takes fluoride out. Are they bogus?
It lowers it. It does not take it out. The fluoride molecule is actually smaller than the water molecule, so you can't filter out something, you can't keep the cats out if it doesn't keep the cow out. Anyway, so the high-pressure RO systems that put the water molecule under pressure to force it through a membrane, that is, the water molecule looks like Mickey Mouse with the 2 hydrogens and an oxygen, so you can force it through and get most of the fluoride out, but a lot of the standard home RO systems remove, 40, maybe less, and that the membranes go bad pretty quickly, especially if they're using fluoride in the water supply. That's silica fluoride. It eats the membrane, so it's reverse osmosis will lower the amount of fluoride in the water. But we bought lots of different waters and tested them. Arrowhead said that they treat their water with the finest system and they reverse osmosis it, and it was the same as tap water. So either they don't reverse osmosis it or they have broken equipment.
I'd like to comment about the G6PD. The Reardon Center in Wichita, Kansas, for the past 37 years is probably the leading place in the country that gives high doses of IV vitamin C for treating cancer, and they check G6PD on everybody. And they found and I attended their course 2 years ago, they said they've had 4 patients in 35 years, the people who had low G6PD. I personally test everyone when I first see them, so I have it in the record, so if I need to give them vitamin C, I can just give it without concern. Dr. Shealy, I also want to, I don't know if you're familiar with Dr. Merrill Garnett, who is a dentist and a physicist who developed this product which for treating cancer, which is alpha lipoic acid that surrounds a palladium molecule, and it actually sets up the same resonant frequency of human DNA, which is the same as the chanting of a Buddhist monk. Poly-MVA, right?
Yeah, I'm not acquainted with his work.
All right, I had 2 comments, now I have 3. We tried poly-MVA in our office. It did not work on anybody, and we gave it a good college try on a number of patients. So we were very frustrated with it, and we tried IV poly-MVA on a couple of patients, and it didn't work. My other comment was on the B12. We've got thousands of patients self-injecting B12. As part of a holistic treatment regimen, we haven't seen anyone do poorly with B12, and we follow mercury levels and do a lot of mercury detox, and I have not seen anyone develop problems solely from B12. And then I would echo Norm's comment on the IV vitamin C. We put Myers in every IV vitamin C. We haven't seen any problems. We've had a couple of patients who have low G6PDs sign a waiver because they want the vitamin C, and we haven't seen anyone run into hemolysis with doing that protocol either. And I would say in our office, we've just crossed over, we're somewhere between 150,000 to 200,000 Myers IVs over the years, and probably 50,000 long IVs of vitamin C. And I would agree with you on, your recommendations with that.
You done? I have a question. I'm interested in electrohypersensitivity. I have two patients to whom we removed some metals in their mouth, and their capacity to deal with cell phones and so on increased dramatically. And recently I was reading an interview with Brian Clements of the Hippocrates Institute in Florida, and he claims that electrohypersensitivity has something to do with heavy metals. And I wonder if someone in the panel, Hal in particular, you've been dealing with this a long time, any comments on that?
I agree. No, we have seen a number of patients who have had some really weird reactions to electromagnetic things. There was one of the first times I ever noticed it was a woman who could walk within 12 feet of a television set and it would turn to snow. And after her amalgams were removed, she could put her arms around the TV set and it would not snow. And there are a series of funny things like that that have happened of childbirth, where things were going along fine and then all of a sudden they stopped. What do you do in case of an emergency like that? Well, you call your dentist. And so I've been involved with some of those and have seen the delivery occur within just less than 3 minutes of disconnecting the electrical heater and radio and things like that in the room. So we keep seeing a lot of different things happening, and it all points back with one finger to primarily to amalgam. I suppose it could happen to other things in the body too, but most of the people we see have amalgam.
Could I piggyback again, Hal?
Do I have a choice?
Yes.
I
Well,
would
I just want to
appreciate
remind
having your
people.
piggyback. Yeah.
I want to remind people that if you carry a cell phone in your pocket, even turned off, and you put your hotel key in that pocket, before you could walk to your room, the key is demagnetized, even with the cell phone off. I've made the mistake of doing it 3 times and had to go back and get a new key. I use a cell phone almost only for emergencies. I carry one with me when I travel. I don't have it in my pocket when there's no reason to be. I don't have an emergency here. And I do not believe in using cell phones for any kind of routine activity. The incidence of acoustic neurinomas has doubled. The incidence of malignant brain tumors has doubled in the last 25 years.
If I might piggyback on that, you're talking about in the United States.
I'm talking about the United States.
If you look at some of the other countries, I was lecturing in Switzerland the other day and found out that it was much higher over there, much higher than double. And they have a different frequency. They wanted to use the same frequency that the United States did, but AT&T, who has the frequency, wanted too much money for them, so they use a different frequency, and they're having far more electrical sensitivities from that.
Interestingly, the frequency that they use, that we use, is somewhere in the range of 80 gigahertz. And of course, human DNA is 70, I think it's 50 to 80 gigahertz in the telephone thing, and human DNA is 54 to 78 gigahertz. So our government, in its infinite wisdom, has chosen human DNA frequency for cell phones.
You're full of all kinds of interesting things, aren't you?
This question is for Boyd Haley, but I see he's left. Somebody up there on the panel might be able to answer this one. Does anybody know when his NMB1 product is going to be available? Years still? Okay.
Well, it's on the fast track in the EU. They've already got it approved for animals, and their clinical trials undergoing with animals at the present time. The last test he thinks that he has to run is halfway through. It's a 4-week test. The first 2 weeks they've fed the animals. They thought he'd fed his animals too much OSR, and they thought maybe less would be bad for them. So he's fed them less, and they're just happy dogs. So anyway, it's halfway through that, so they expect that to be done by the end of this month. And they go back and say, what do you think of that? And so it may be available as the beginning of summer. They're ready. The first batch of stuff they're going to make, I think it was, I forget, several kilograms, 1,300 kilograms, I think is the first batch. And then, if that goes well, then they can step it up and produce more. But anyway, it's on the fast track in EU, and if you get a dog, you probably could get some for the dog.
This question is for Dr. Huggins. The DNA testing that you do, is there a special lab that you use for the DNA testing? And if we're looking for anaerobes, how do you get the tooth out without exposing it to the air so that you can test for anaerobes?
Yeah, it doesn't matter whether you expose it to the air or not because you're looking at DNA. DNA, the bacterium may die, but the DNA doesn't. The DNA is there, so you can do DNA on dinosaurs.
Okay, who are you using for a testing lab?
My lab down the hall.
Okay, that works.
It's called dental DNA, but we do have the most sophisticated technology there of any DNA laboratory in the United States. The man who runs the laboratory worked with James Watts. In fact, he was with him 2 weeks ago. Worked with him for about 17 years. And we ran into a problem that I don't think we have ever even anticipated before, and that is hypersensitivity. That the sensitivity of the laboratory got to the point where generally you're looking, if you find a report from 25,000 bacteria, this is considered pretty sensitive. The head tech there is called Tweak because that's what he does in the lab most of the time. He got some of the tests down to the point where they could detect one bacterium. Now, one bacterium is not going to create a problem. So in order to get it into something realistic, I moved it up to something like 10,000 or 20,000 bacteria as being the sensitivity point. So it is highly accurate, more accurate than what we need, but in this laboratory, I will say that at least one time a week, something happens that nobody had any idea was going to happen. And the primary reason for this is nobody looks. But if you start looking at what the dental materials can do, especially the stuff that I've come up with recently, the marriage between metals and microbes, it used to be when I went to school, if somebody got pneumonia, what'd you get it from? Well, probably strep pneumonia. What is it that gives you polio? Well, the polio virus. And it was a one-on-one system. And now, through stimulation with very low dosages of these metals in conjunction with the bacteria, we can get a bacteria to produce 5 toxins that it never used to produce, some of them 15. One has been reported to create 97 different toxins. So this is why I say the future is something that should be considered, because there are just too many more toxins being formed than have ever been formed before, and most of it is due to mutation. And it doesn't take rocket science to put these things in there and test them a week later and find out that you are creating toxins that weren't there before.
Okay, great. This hopefully will be an easy one. A nursing mother wants to get her amalgams out, what does she do with the breast milk during the time period that she's doing the amalgam removal?
In tests where we have looked for mercury in breast milk, it used to be that we recommended pump the breast before, then put it in the refrigerator, and then take the fillings out and so on. But in actual tests, we find that the mercury level drops within a few hours. We've never tested less than 8 hours, but at 8 hours, the mercury level has dropped precipitously. So my recommendation there is get the fillings out yesterday, that it is not the problem that it sounds like it should be. It sounds like there would be a spike increase. When you measure it, you find there is not a spike increase.
Okay, so 8 hours is a reasonable time frame?
Well, 8 minutes, as far as I'm concerned, would be closer. No, I don't see a time frame as being necessary.
Okay.
Because at 8 hours, we find it's already at 0. Well, probably
one
it's
last
at
question.
0 at 7 hours, too.
One
So
la-
the important thing to me is to protect that child's brain and get that stuff out as soon as you can.
One last question. A new patient comes in and is a non-believer that he's mercury toxic. Is there one blood test that you would run that would be more specific and more dramatic in terms of showing the patient the toxicity?
Wait just a minute. I need a translator. Yeah, if the question is there one test that demonstrates mercury toxicity more than anything else, the answer to that is no, because it is entirely individual. There's some people, what I'm looking for now is a drop in lymphocytes. I see that a lot, but you will see a drop in albumin. You will see a drop in serum calcium. Everybody has his own weak link. And that's what we look for. We have a whole series of chemistries that we can look at, and the one that got out of whack is the one that we're going to pay attention to. But is there one test that proves, yes, you're mercury toxic, no, you're not, no, there isn't. And if you carry that a step further, it becomes even more sensitive, because if a person has had their amalgams removed, they go into what immunology calls a secondary immune response, which is the theory behind vaccinations, such that a person can have a reaction at a level 10 to exposure to mercury, just picking a number, and after their fillings are removed, if they're protected when it's removed, if a compatible material is placed and all that, that 10 may drop to a 0.001, so that it requires much less exposure to create a heavy reaction after you've had your fillings removed, if they were removed properly.
I'd like to comment on the breast milk issue and amalgam removal during pregnancy, et cetera. 100% of the experiments that have been done to date, and we need to have Matt and Joe Palmer get together a couple of dozen pregnant women, test them out. But no, that's not ethical. But anyway, the Moline in 90 and again in 95 found large spikes in the blood mercury level and a gradual drop. It didn't pass baseline in 8 hours. It was a number of months. In Moline, SNAP did a much better job of protecting, and so that he too found a spike, but it dropped down below the baseline at in a matter of weeks. And SNAP found a 90% drop in the blood level of mercury in 214 days. Hence Mike Ziff's old recommendation years ago that if you want to get pregnant, then get your amalgams out 214 days before you get pregnant, because even if you do it carelessly without following the Dr. Huggins protocol, the IMT protocols to protect the patient, you can get a 90% drop. Moline did not get a 90% drop. She caused a huge exposure. She was using water spray and high vacuum and rubber dam. She got a huge exposure, and she only got a 50% drop at the end of 12 months. So, but still, it's still lower than it was to begin with. That we did a number of experiments with animals, which is, in my opinion, the only ethical way to look at this, or in human retrospective studies. And then in the animals, that when they placed amalgam, the sheep did have mercury, considerable amount of mercury in the milk. Wayne King, who's not here at this meeting, collected a lot of mercury from the mothers in his practice that were nursing, and a number of other dentists contributed, myself included, milk from nursing mothers. And we also assessed the oral cavity using the VIMI protocol with the Jerome, so that they had an oral measurement as well as the amalgam count. And we showed that the amount of mercury in the mother's milk was proportional to the number of fillings in their teeth. So Hal is absolutely correct that if you want that baby's brain to come out okay, get them out yesterday, like the day before you get pregnant, so that you can get past that spike and recover. But the Academy has taken the position that we don't recommend removal during pregnancy, because nobody has, to our satisfaction at least, shown that they can prevent that spike. And the reason we say that is in 1957, Frickholm put in radioactive amalgam fillings in fellow dental students, rats, and so they had a big spike in radioactive mercury coming out of the urine. They weren't even looking in the right place. And then they removed the amalgams after 6 weeks because the radiation had dropped off. And all 7 patients, again, experienced a spike in the radioactive urine. The one guy went up and had his teeth extracted because he was having a denture made. He, too, had a spike in his radioactive urine. So whether you have the fillings drilled out or you extract the teeth, that apparently there's additional exposure during the removal of the filling because of the saturation of the jawbone around there.
I would respond to that, though, in that we've submitted somewhere around 50 blood samples to Chris Shade, and all of these patients had multiple mercury fillings. We followed the protocol that Hal has recommended for years, with obviously rubber dam, water spray, high-dose vitamin C. We got before and after results. We drew blood again 3 or 4 days after having removed all those amalgams, and in not a single patient did we elevate their blood levels of mercury. And he was testing, of course, for ionic and methyl mercury. I like his test because he gives you both.
I would like to add to that when we were doing our testing, that we weren't just taking out fillings, we weren't just using rubber dam, but we were going through the whole program of balancing the body chemistry, using the blood chemistry, the supplements that we have had made that we can't talk about at a meeting like this. But they do alter the cell membrane selective permeability. And if you do all of those things together, then we do not see the spikes. But I didn't listen to that because of the bad commercial implications.
Well, listen, it's almost 5:45. We have a big party getting organized by the water at 6 o'clock. Let's give our panel of speakers a great hand. Thank you for answering all our questions. And we'll see you tonight and then tomorrow morning at 8 o'clock to start again. Thank you very much, gentlemen and ladies.